The topic that we have decided to talk upon, I wish that we had not had this in our vocabulary, in our daily lives, and it's something which is not a happy topic. International cooperation part of it is excellent, but during a pandemic are not the happy words. Unfortunately, this is a reality which has hit us, and it'll hit. If it hasn't hit you, it will hit you at some point or the other. How badly and how easily you will get out of it is something which nobody can really tell. The definition of a pandemic is basically an epidemic which is global, worldwide. It strikes as certainly as it's as air, as oxygen spreads around the world. This is the way it spreads. It's something which has hit us, all of us, out of the blue, literally. People have complaints, of course, natural, that this restrictions, that restrictions, this is crazy. How can we do this? Okay, for the time being, we'll stick to some restrictions, etc. But come on, this will obviously end after some time. This is like, let's say, getting the flu. Probably the one and the only, frankly, two, if I can put it that way, things that are relatively positive from this pandemic is there is international cooperation. People have suddenly realized, and thank God for that, that the human race is one. And no country is smarter than the other. Each has got its fair share of brilliant people and not so brilliant people. The idea is to get those brilliant people from every country together and work to find a solution. As I mentioned earlier, that this is one of the positive things. Now, amazingly, what it also has resulted in is formally or relatively hostile borders are also coming down, at least for the duration of this pandemic. And let's hope it continues. Now, for example, in one of the most hostile neighborhoods, frankly, the neighbors don't talk to each other, is the Middle East, West Asia. And something which, frankly, those people who have lived in that region, who know the area, who have studied in that region, would not have believed this day would come when the Arabs and the Israelis are cooperating. They're talking to each other. They're trying to find solutions together. They're trying to work together. As a matter of fact, the Prime Minister of Israel is quoted as saying that the health ministers from the UAE and Israel are planning to work together. The health ministries and the ministers are planning to work together to basically to provide health security for the region. There are conspiracy theories which go around. Oh, these people created the virus, so therefore everybody's got affected. Those conspiracy theories are out of the window. As a matter of fact, the UAE ambassador to the United States has been quoted as saying to my organization, the American Jewish Committee, Israeli Arab cooperation, UAE cooperation, there is potential room for cooperation. That is the quotation. And it is an open quotation during a webinar that we had organized. So this is not that nobody's hiding. There are no hush-hush meetings. There are no hidden secrets. There are no backroom negotiations. People are openly meeting and talking and discussing what to do. There are flights arriving from the UAE, from Turkey, carrying supplies, carrying medicines, carrying healthcare equipment, which is land aircraft from Turkey aircraft from UAE, the Emirates airline, are landing at Israel's Ben Gurion International Airport. They could have gone anywhere else, but no, they're landing at Ben Gurion International Airport for medical equipment, health equipment, healthcare equipment is being brought in to help the Palestinians in the West Bank and Gaza. Now, this is a border which, and now coming to the West Bank, at my age, in my mid to late 40s, I remember reading about the West Bank, trouble in the West Bank, or some shooting in the West Bank, or something or the other, right from my childhood, from the 80s, 70s, and 80s. So you can imagine how long there's this conflict been going on between the Palestinians, and of course, it's over a century old now. But even when it comes to this conflict between the Israelis and the Palestinians, which is going on, for a very, very, very long time. Even there is a scope for working together, where doctors, medical healthcare workers have left politics behind. They have taken the initiative and said, no, we will work together. And again, this is not a condescending kind of thing that the Israelis know better and we will come to teach the Arabs. No, nothing like that. Everybody's working together. There are Arab doctors working in Israeli hospitals. There are Israeli doctors who have gone to provide assistance and training at Palestinian West Bank hospitals. So medical supply is being brought in. There is a methodology being introduced. There is a teaching aids being introduced. And even something which normally doesn't happen, the Israeli parliament has passed a law, the Knesset. Immediately it passed a law, it doesn't delay things, that the employers of Palestinians who enter the territory of Israel to have to, daily wagers who come from the West Bank, etc., to work and then go home at night, have been instructed that they will pay for health insurance for these workers in Israel if they have to stay overnight and they get infected. Obviously, if they get infected, they can't go home. So they will be hospitalized, and that payment will be taken care of by Israeli employers of those Palestinian daily wage earners. This gives a lot of scope. This gives this is an opening, and sometimes this is the opening which is required. And just to divert a little bit, in China, for example, Chinese-American relations after the communist takeover in 1949, the first time that things really moved was around the late 60s, early 70s. Now, other people are working together, and here we're talking about, of course, international cooperation during a pandemic. Let me also get back to a reference which I had mentioned once earlier, is when I mentioned Turkey. Turkey and its neighbor Greece have been at loggerheads for centuries. Let's not, they're worse than even our neighbors and us. They've had their conflicts going on for a long time. But what happened? They were hostile. But you know what happened? There was an earthquake which happened literally back to back in Greece and in Turkey. And guess who were the first ones to land up with assistance? Their neighbors, their previously hostile neighbors. They're not best of friends or anything like that even now, but they talk to each other. This is the kind of thing where national pandemics, or rather international pandemics, international disasters which happen is what brings out best in people. For example, one of the initiatives that was begun a couple of months ago, sometime I think March, April or so, was in Europe. Was something called the Austrian initiative by the country of Austria in Europe, which is an EU country. The idea behind it was that kickstart the economy, which has frankly affected countries with small has affected everybody, but especially those with smaller populations, and because the economies don't really, it takes a little time. Now, so what have they decided to do? They've decided to exchange tourists only from within their countries. That's it. Like let's say Austrian tourist will go only to Israel or Australia or New Zealand. He will not go anywhere else. Maybe not be permitted to. So this kind of a thing. Now, there are problems behind it, but the thing is there has been an initiative taken. What happens when a second wave hits? The rules are very, for example, clear about it, which says that there has to be social distancing, masks are compulsory, second and quarantine has to be done, etc., etc., etc. So this is the kind of thing which cannot be ignored. Countries will try their best to do what they can, because it cannot continue in this kind of a situation. Now, when it comes to larger countries, and obviously like Germany, France, and all that are not too happy about this, because they say the EU rules mean that Austria, as a member of the EU, has to ensure that tourism from EU countries should be allowed to enter first. But they've said no. Now let's see. Well, that's an internal problem. So best of luck to them about how they handle it. But this is what desperate situations call for desperate means. Now you've obviously invited me here as with my designation, and as Pratiksha has also introduced me as the India representative for the American Jewish Committee. So I would like to also mention what is going on with our organization, our NGO. The AJC has also started webinar series, whereas we, as facilitators, we're not medical experts, As facilitators, what we do is we create webinars in which experts talk to experts for the benefit of all those who have logged in. And we send out invitations globally. So let's say, suppose somebody is a vaccine specialist, let's say medical authority. Then one of our staff or one of our senior members of our or our CEO sits down and has a chat with him about how are the vaccine trials coming along, what steps are taken, what is the next stage, how much time can it take, because these things don't come easy. So, and all those stories that are coming out, and that's what I call them in the media, that such and such countries come out of the working vaccine, is ready to go, and trials are over. That's not really true. And even those countries like Russia had this story out about a couple of days ago, and they had to backtrack by saying, no, actually, that was a mistake. It's just the human trials are going to begin, and then things will happen. The fact of the matter is, in such medical trials, no matter what kind of a medicine it is, and especially one that is required at such a critical time, such as this pandemic, such as COVID-19, is they have to be very, very, very careful about human trials and actually releasing it in the market, no matter which country. No matter which country. Russia, Israel, India, China, America, Australia, whatever, UK, whichever country. So, coming back to what I had said earlier, that international cooperation is not just happening in the West and the Middle East happening, it's even happening, even India has taken the lead. As a matter of fact, India was one of the first to go in for a complete shutdown. It was not comfortable. I can personally vouch for that. It was a little shock to the system that, you cannot step out. You can't do anything, but I have to buy my groceries. No, you cannot. But I have to do this. No, you cannot. I have to do this. No, you cannot. So what we decided then at the Ministry of Foreign Affairs, our Ministry of External Affairs, our Foreign Ministry of India, has decided to start off using our extremely skilled diplomats, extremely skilled international ambassadors who have got great experience in negotiations, etc. Have decided to work with different countries, and I'll just give on your screen also you can see the kind of collaboration that is happening. It's just starting. This is collaboration. This is the starting phase. Nowhere on the screen do you see, on that graphic do you see that work is over. So and all these points that you see are actually happening right now, and this is a two-way street. This is not a one-way. This is simply not one way. If somebody thinks that India is only receiving and not providing, no, quite mistaken. And what is happening now, whether it comes to the Middle East, whether it comes to Austria, whether it comes to the United States, whether it comes to India, whether it comes to other countries, and all of us who are also here, working people, professionals, students, we don't know. And anybody who tells you otherwise is, I'm sorry to say such a blunt word, he's lying. That this is going to come to an end. This is going to come at some point. Oh, January 1st, December 2020, you can plan your New Year vacations. No. Maybe yes, but definitely not a certainty of yes. We just don't know. This could be an existentialist threat for all I know. I don't want to sound alarmist, but 100 years ago there was a Spanish flu which happened in 1918. Infected 550 million people globally with 100 million deaths. Now, this is when there was no, transatlantic travel, or people were not roaming around, and tourism, where you could travel to the United States in 12 hours from India and that kind of a thing. That didn't exist. Even taking those, it was 100 million people who died. And just in the span of a year. Now this is 7th month, July. We just don't know. What I can say, however, the only certainty which is there, which is a sort of only certainty that I can really speak about, is there is going to be quietly, but certainly there are going to be global alliances that people are going to work, that people are work together. People are going to work together globally. Foreign ministries will have to change their the structure of their foreign ministries. They'll have to add what do you call it? Network diplomacy will be the next phase which will happen. The ministries will have to now gear up to not getting posted abroad as much as sitting in their home countries and trying to work together to create initiatives like I mentioned in this graphic about how to work with other countries and trying to ensure that networking, get the best out of each country and implement it globally. Whatever it is, whether it is you want international cooperation is going to reach a different level. Hopefully, this is what is going to be the future. Working together, global alliances are going to come in. And frankly, we just don't know where this is going. So for those of you who are watching this, the optimistic young people especially, best of luck to everybody who's watching this. But please be careful. Please don't assume that this is over. Please don't assume it is dying down. People, the doctors and global doctors, global healthcare workers, doctors are talking about a second wave. Some countries have already been hit. You know what has happened in Sweden, where they did not go in for a shutdown. They have been hit by a second wave. It can happen. Now, this is just the second wave we're talking about. Is there a third wave? Is there a fourth wave? Is there a fifth wave? We just don't know. So as far as that basic line goes, we don't know. Please try to be careful. Not try. Please be careful. Stick to the new rules. This is a new normal. So, you can't just land up at the airport and catch a flight and go anymore. You have to make sure you adhere to the rules. You can't just go to a movie as you wish. Oh, what's on Book My Show today? Let's go and see a movie. It doesn't happen. Let's go and meet for a Starbucks coffee. Those days are over, unfortunately. Even if at some point it happens where there is an all clear given by the world's healthcare workers, by the doctors, that okay, this has been destroyed. There is no more pandemic, no more COVID-19, etc. People are still going to be worried, and rightly so. People are still going to be careful. People are still going to be a little panicky. People are not going to take it easy, because all those times that people have said it cannot happen to me. That is the keyword, when it can happen. So all I call out to all my friends here is, and those watching, is please be careful, please watch out, follow the rules, nobody's immune, and take care. Thank you so much.